everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I am your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we're going to have Dr. Eryn lead this whole entire discussion. It's going to be about informed consent and what's going on today with this new administration. I will say this, just to preference it. Our podcast will never go and be political, but there are going to be some health topics that do drag politics into it. Trust me, I've stopped listening to a few health podcasts that are now doing a lot of political episodes. It's just not the realm of expertise, and we will stick to our expertise, but just understand that when decisions need to be made about public health, politics do come into play. So this is more just informing you about informed consent.
Yes. All right.
So yeah, take the lead, because I don't even know where to go with this. This was your topic.
Yes. Do you know what informed consent is?
If I'm going to look at informed consent, I'm going to say the informed part comes from the practitioner, where they're going to inform about the pros and cons, and then the consent comes from the patient, where they're going to say yes or no. Yeah,
that's a pretty good straightforward breakdown, right? This is a medical legal term, and so again, lawyers get involved in medicine a lot. But informed consent is basically a process where the healthcare provider share essential information about a procedure. Usually it's typically that's the venue where it's used, with patients about a procedure or treatment, and that includes, like you said, the risks, benefits, and alternatives. So not only just the goods and the pros and the cons, but also what else you could do. That way patients can make an informed decision about their care. It kind of empowers the patient to actually know what they are choosing and if they're okay with their medical options. It is a legal and ethical requirement in medicine. Informed consent has been around for years. Again, like I said, it's typically used for procedures. So if you ever get a surgery, I know you remember when you had your ankle surgery, they tell you what the pros and cons are. Usually at that point, you discuss alternatives.
He's like, hey, so we're going to put the stabilizer in there. Would you want to do that? This is what it does. And I'm like, Doc, you know better than me, man. Just if you think I should, then just go for it and do it.
Yeah. And that's usually how patients typically react, is, the doctor knows best. But that's not always how a patient, I was going to say, that's not always how a patient should react, right? You should ask questions. You should be able to feel empowered to really know what the risks and benefits are of a procedure or treatment. But if you look at the core elements of informed consent, usually they discuss like their diagnosis. A physician, for example, or a provider would discuss the diagnosis of the patient, and then the nature and purpose of the recommended intervention, whether that's a treatment or a procedure. And in this case, we'll get into the public health realm a little bit. But now this is kind of touted to be done for vaccines, which I think we did, but we'll talk about it later in the public health realm. Give informed consent for vaccines. The risks and benefits, like we said, and the alternatives, including opting out of treatment. The provider should ensure that the patient understands information and also have the capacity to make a decision. So, for example, if you have a patient who has dementia, then that gets into more legal issues where they probably need somebody to make a decision for them because they may not be of sound mind. They have to give their consent voluntarily and without coercion. And it's not just signing a form. We typically think of it in realms of the procedure, like I said, or a surgical procedure. But it should be a conversation, right? An open conversation between the patient and the physician, where the patient understands their options and can ask more questions. Providers should use clear, non-technical language basically layman's terms. And sometimes they can actually ask the patient to teach back, which kind of sounds demeaning, but it's just to make sure that the patient understands whatever the procedure is or the treatment is. And usually there's some kind of documentation on the physician side or provider side about the conversation. Why is it important? Why do you think it's important besides legal implications as a patient?
Well, I mean, does that touch into the whole, it's my body, it's my choice?
A little bit, yeah. So it protects the patient autonomy and empowers individuals to make choices that align with their own values, right, and preferences, and it builds trust between the provider and the health and the patient. It could reduce confusion or surprises, and I think of it as a little bit like the pharmaceutical now companies can advertise, and you know how they say all the bad things that can happen at the very end.
Yeah.
So it's
they
like
put it on like 3x speed.
Yeah, but the point is taken that at least they're telling you what the side effects might be.
Yeah.
And usually that includes death in those advertisements. But let's talk about vaccines. So this is a kind of a newer thing. I think we did have informed consent. We'd always inform our patients about vaccines, i.e. the risks, the benefits, that sort of thing. But now they're pushing, this administration is pushing more for patient autonomy. In other words, the patient can really decide whether they want to vaccinate or not themselves or their children, for example. So like I said, with vaccines, we've always had some form of informed consent. In other words, discussing the risks and the benefits of a certain vaccine. But now with this administration, I think there's more relevance in that people can now turn down vaccines, which might be adding to people not getting vaccines. And there's, again, in the public health scope, there's an interesting play between autonomy and what's good for the public good. And you see your daughter in the background. Mm-hmm. So basically, if we had to introduce the argument, sometimes in the public health realm, there is a justification to override individual autonomy, and that comes into play when vaccination is essential to prevent outbreaks and to protect vulnerable populations. For example, the measles vaccine is a big one right now, right? We're seeing a lot of measles outbreaks around the U.S., which we haven't had. We actually back in the 90s, there was no measles cases because everyone was mandated to get their MMR vaccine. And now, we see pockets of outbreaks. And for example, we have a baby who is under a year old, which is typically when you get your MMR vaccine. And that is recommended because of their maturity and their immunity at that time. If there's an outbreak in the area, then sometimes you can request it earlier. The typical recommendation is 9 months, but you can request it up to 6 months in a child. It just means that they'll get vaccinated extra times for MMR, which would, or measles, which would then, confer the immunity after a year old. They get some immunity if they get it earlier, but it's not 100%. So, for a while we were really fearful of taking our baby out because there is measles in our area. And so we kind of were watching and making sure that we weren't going to any areas where there was an outbreak. And so basically other people's decisions can affect the greater good. And so, so that's why the public health realm is a little bit different than, for example, an individual procedure if you're getting ankle surgery, for example, informed consent makes a lot of sense. Not that it doesn't make sense with vaccines, but the individual autonomy needs to be explained to people. What do you think about that? Because, public health mandates are not very popular where somebody is made to get a vaccine.
Well, COVID, I feel like, ruined everything in terms of trust. And now, if you get told to do something and to take something by the government, it's going to automatically be frowned upon. Having the way that like I would look at it would be like a logical way and say, all right, well, if I don't take this vaccine, what are the chances of if I don't give my kid this vaccine, what are the chances of my kid getting it? And it's like, all right, well, if I do take the vaccine, what are the chances of my kid getting harmed from the vaccine? And the chances of the kid getting harmed from the vaccine is way less than catching it and then having that disease and the harm there. So, I mean, I've just got it from a logical perspective, but you're going to have people that really believe that the government's against them or big pharma's against them, wants to keep them sick, wants to get them sick. You're not going to change that narrative with this podcast.
Yeah.
So my whole thing is like, just look at it logically and go from there. But I will say that when it comes to vaccines, you got to think like I didn't need the COVID vaccine because I was young and healthy. But if I had it and I gave it to my parents, then I would be the one to blame for that, right? And like, do I want to live with that? Do I want to have that in the back of my mind? Just because I didn't need it doesn't mean that the people around me don't need it. So that has to come into play too. But then again, it's like, well, it's my body, my choice. And when you look at it from that perspective, it's very selfish. But being selfish isn't necessarily a bad thing either, because it is your body, your choice. But the problem with doing that is that if everybody just looks out for themselves, and a lot of people believe like, oh, the vaccine's going to harm me, and you get this narrative gets pushed and more people believe it, what's going to happen is you're going to have these outbreaks and more people are going to die. And that's my stance on it. I'm for vaccines. I just feel like the benefits outweigh the risks by a tenfold. So I don't know if I answered your question.
Yeah, no, I think this is a very gray zone for me personally, because it does intersect, like we said, between politics, public health, and medicine. And as doctors, we don't like to get political. And as a physician myself, I'm all about patients' rights and individual autonomy, and making sure that the patient really understands what they're getting into, and that they're actually want to do the procedure or treatment. Like we're all on the same page, we're on the same treatment, because it makes everything go a lot smoother. I think it's tough though when you have to make a decision that might not just be for your well-being. It might be for the well-being of public health or people around you. And I think it's very difficult because it's very easy to be selfish in that regard and say, well, I don't really need this vaccine, or like you said, I'm healthy and I really don't need the COVID vaccine at the time when COVID was happening. And so it is kind of difficult. I think it puts the onus on the medical providers now to really show that vaccines, and explain to people and educate people that vaccines really do their job, that we've had years and years of proven research that they do prevent disease. And, I can't just, I wish everyone would just go out and get vaccines because they look at the data and say, wow, there's no way that this is, that the benefits so much outweigh the harms, and help the greater good, that it seems like an easy decision on my end, as a physician. But I think right now, with all the misinformation out there, it really puts the onus on providers to really kind of share that evidence with their patients now. And it's difficult because, we barely have enough time with patients as it is. And so now we have to do this extra piece of education, which a lot of providers don't have a ton of time to do, let's be honest, in your 10-minute visit. And so, it's very difficult to sit there and kind of, explain the misinformation that's out there. But I think in this day and age where we're at right now, it just really puts the onus on the provider to do this.
Well, I don't think that responsibility is going to change anybody's mind. If they go into it with the mindset of conspiracy, then you're not changing their mind. It doesn't matter what you tell them. And we could see that today. If you want to look at just the field of health or even the field of politics, doesn't matter what evidence you put out there, people are going to believe what they want to believe. So.
That's true. And I think that's hard, right? That's the hard part. Because I think certain patients, even given evidence, they're going to choose something that coincides perhaps with their belief system. It's going to be difficult to undo some of the harms of misinformation out there, where these beliefs may be rooted.
Yeah, I mean, just if you look back at like how we as a species were able to evolve over time and like stay alive for as long as we have and not actually go extinct. And a lot of that is with community and making sure that the community exists. And in order to do that, we have to make sure that the majority of the community is healthy in order to keep going on from generation to generation. So if we're just worried about ourselves or our family and we risk the masses, it could lead to disaster. But like I said, it's not going to change anybody's mind anytime soon unless something terrible happens. But when you got told you were going to lose your job if you didn't get a vaccine, that just put a bad taste in people's mouths.
Yeah, I agree. I think that it was a difficult time where providers and scientists probably could have done a better job of saying we don't know a lot of times instead of saying yes, this is the way. I think unfortunately the way science is that we don't know a lot of the answers, and I do know that vaccines have been around for a while, so I'll continue to recommend them to my patients. I know the efficacy of them. I get them for my own child. We got hers early just because, again, we were afraid of
there were measles cases out there. So.
We're contacting measles, and I do know that disease is much worse than the vaccine itself. So anyway, I hope that kind of helps explain the current situation. But if now, they talk about informed consent at your doctor's appointment, especially if you're just going in for, routine vaccines, you kind of know where that's coming from. Not that it's new, but that it might be pushed a little bit more now because of this current administration. Yeah,
and so we're providing you with the information, but it's only advice if you put it to use. So yeah, hopefully that helps clear up anything when you head to your doctor's office and you hear that. You now know exactly what it entails, and we just hope that you guys make the right decision, whatever that may be, right?
Hopefully it's to get vaccinated. All right.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.